get ready to take control of your healthcare. Here's your host, Ray Cobra.
And we're live. Ladies and gentlemen, welcome to Broken Healthcare. My name is Ray Cobra. I am your host, and I am delighted to have with us today Wendell Potter, former Cigna executive and insider, folks, who knows all the dirty secrets. And today, Wendell is an investigative journalist, investigative reporter. He runs a newsletter that's available on Substack. Welcome to the big show, Wendell.
Ray, thanks so much. It's great to be on the show. I'm glad we finally got this scheduled.
Awesome. Hey, I've seen you and heard you keynote and speak out there on the circuits that I run in, and really I am delighted to have you. Folks, Wendell is often tapped on by the media, to comment on things that are happening in the news, and there's no shortage of stuff happening in the news surrounding healthcare. So his time is extremely valuable, and I really value you and your opinion, Wendell, because there aren't many people that can claim being an industry insider in one of the B.U.C.As, Blue Cross, United, Cigna, et cetera, et cetera. You are one of those folks, so you know what happened behind closed doors, and eventually it was something happened that caused you to have a change of heart and term whistleblower. What was that moment for you where, it was the straw that broke the camel's back?
Thank you. First of all, I'm going to say I'm really grateful for having the chance to have worked in the insurance industry for 20 years because I learned a lot about how our health system works, how health insurance works in this country, how it has evolved in ways that, frankly, are not very good for most of us, except a few executives. And I was one of those executives for quite some time. I rose up through the ranks to a position that gave me visibility into the company broadly. And a lot of the work that I did was directed toward investors, but also policymakers in Washington and the state capitals. I was loving my career, or thinking I was, until I went back home to visit family in Tennessee, where I grew up. And while I was there was a life-changing event that led me to my decision to leave the industry. I went to what was referred to as a healthcare expedition that was being held not too far from where I grew up in Kingsport, Tennessee. It was at a county fairground. When I got to the fairground in this small town, it was in the southern Appalachian Mountains, and when I got there, the parking lot was jam-packed with cars. When I went through the fairground gates, I saw something that just I couldn't have imagined seeing in this country. People were lined up by the hundreds. Those lines stretched out of sight. And I noticed almost immediately that some of those lines led to barns and animal stalls where people were being treated. Volunteers had cleaned up those barns and animal stalls the night before. And the animal stalls were examining rooms. And it just broke my heart. I realized immediately that I could have been one of those people. I grew up in that part of the country, and I'd been lucky to get a good education and obviously have a very good career. And those folks were not nearly as fortunate. And I learned that a lot of those folks had health insurance. It wasn't just the uninsured. And at that time, this was in 2007, the number of people without insurance was increasing every year, and it was getting close to 50 million. But a lot of those people had insurance, and they were in plans with very high deductibles for the most part.
Yeah.
And these people just didn't have the money to pay their deductible. They couldn't go to the doctor. So they waited for months and months and months and drove hundreds of miles because they had heard of this expedition, this medical event that was put on by an organization called Remote Area Medical that Ray was organized by folks who were flying U.S. doctors to very remote parts of the world, like Haiti and Africa, some very, very small, very, very poor and remote communities. But they started getting calls from communities in the United States asking if they could bring one of their expeditions to their communities. And today that organization still exists, still does these medical pop-up clinics around the country. And most of them are in the United States. they don't have the capacity, the time, or the resources to fly these doctors overseas because there's such a great need in this country. And that changed me. It changed me. I knew that I was part of the problem, Ray, when I saw that I was trying to my job was in many cases, many ways, to mislead people to think that everything was just fine.
Yeah, that's just crazy. What really impresses me about your story is the fact that it happened right here in Main Street, USA, right?
Yeah.
So
Yeah.
maybe not the most affluent community, right? But these are people that have healthcare needs in the same way I do, or that any of us do. And they actually went out of their way to find this organization,
Yeah.
see that they do outreach to impoverished communities across overseas, and then request that they come to their local hometown to do the same thing. That's incredibly telling of what's going on in healthcare. And I guess you witnessed it firsthand, and it really shook you.
It did. It was. I've often referred to this as kind of my drive up there as my road to Damascus, because I went there not expecting anything like that. I didn't have expectations. I thought it was just kind of like a clinic, a healthcare fair where you get your blood pressure checked. But it was far more than that. There were people who were there who learned first time that they had life-threatening conditions, who were being treated for that. A lot of people were there for dental care because a lot of people don't have dental coverage. But it was just stunning. And I also, Ray, I was a reporter in my first career, and I also came to a realization that what I was doing for a living and was being paid much better than when I was a reporter. But what I was doing at that time was being paid to mislead people rather than to inform people in an honest way. When I was a reporter, I really made an honest effort every day when I went to work to never mislead people, never to knowingly obscure or leave out important information. And that's what I was paid to do, to make people think that our healthcare system was the best in the world for all of us, and the way the status quo couldn't get much better,
Right.
because I'd been one of those people who had become affluent and was able to keep a distance from the way so many Americans live and have to try to access healthcare.
So I want you to take us back, but before you do, you're such an important figure, and you do make yourself accessible. So I want to be sure to let the audience know the best way to connect with you and subscribe to your newsletter. How would they do that?
Well, thanks. Yeah, my newsletter is called Healthcare Uncovered, and as you noted, it's on the Substack platform. You can go there. You can find me at Healthcare Uncovered, spelled together, healthcareuncovered.substack.com, and it's free. You'll see Substack's always saying you can subscribe and pay, but I want to make sure that our content is free to everybody. Fortunately, enough people pay for it that we get some income and to be able to support it, but it's free content. So just click on no thanks, and then it'll take you to the content.
For the record, folks, I'm a paying subscriber.
Thank you.
It's really good stuff. It really is. But it's awesome that you make it accessible to everyone for free.
You. And thank you for subscriing and paying for it. That helps. I appreciate it.
I'd kind of be a hypocrite if I didn't, support the community. And so it's just a small way that I can support your efforts and getting the word out and what's going on in healthcare. So it's my honor and my pleasure. I want you to take us back to your early days of reporting, because when I hear a reporter, I hear a good person. I don't know if that's accurate or not, but certainly I think I was a communication arts major, and going back and thinking about my education and the constraints that the government had, the FCC had with the rule of sevens and the rule of 12s, and the idea that the media, there shouldn't be one entity that owns many, many media outlets because they would wield too much power. And we've gotten away from that, today, of course, and media is just everywhere. And we hear the term fake news thrown around, and there's Facebook, and people get their news on Facebook and other social media outlets. And it seems to have lost its integrity. the news outlets and the mainstream news media now seem to, in my view, have really lost touch and I think lost the faith of the people. And I think it's really about corporate agendas and distancing or getting away from reporting the actual facts. Just the facts, ma'am. Only the facts. And there's too much conjecture and nonsense involved. But, you're a person that I'm sure grew up with, Walter Cronkite, and CBS News and stuff like that. I was a kid back then, but that was like an incredible moment where you had a journalist, and news anchors were considered journalists, right? Especially back in the day, they wrote their own stories and stuff like that. But when he reported about, the landing on the moon, the entire world was tuned in, and people believed what they were seeing and what they were hearing because that it's just the way that it was. It wasn't even a thought that this is being misreported or that it's not accurate. And so I'm inspired by the fact that you started out as a journalist, because I think that's very telling of, kind of your heart and your character. So take us back. Tell us, what'd you want to be when you grew up?
It's funny you mentioned Walter Cronkite, because I did grow up with Walter Cronkite, and he was a hero. I wanted to be a Walter Cronkite when I grew up. I honestly did. There's for a time I wanted to be an architect, but that wasn't I didn't make the best grades in math and science as I did in some other subjects. But I got a chance when I was a senior in high school to be a correspondent for my high school to my local hometown newspaper, the Kingsport Times News, and I just kind of fell in love with the idea of being a journalist and a reporter. And I would later get an internship at that paper and then go on to major in journalism at the University of Tennessee. And I've always loved being the idea of being a journalist. And even I sometimes joke that when I was in the insurance business, I was undercover for 20 years. And now I'm able to write from a perspective of a former insider about what I learned. But it did shape how I view the world and how I want to try to make sure that people get information that is reliable, that is truthful. You're right. The media landscape has changed so radically. I think that I probably was able to be a reporter during what might have been a golden era of journalism toward the end of that era. But I was able to be a reporter out of college at a big town newspaper in Memphis, and then I was able to cover state government and politics in Nashville. And then at an early age, I was able to go to Washington. I worked for Scripps Howard. The papers I worked for were owned by Scripps Howard, which no longer owns newspapers. And I was in the Scripps Howard News Bureau, and I had a chance in my mid-20s to cover Congress and the White House, the Supreme Court. It was an incredible experience. So I got a chance to see not only how journalism works, how the media works or worked at that point in time, but also how government works, how our democracy really works or doesn't work for voters. So I've had an ongoing education for half a century in journalism and politics and business.
So how did that shape your future and your segue out of journalism into the insurance industry? Obviously, that experience to draw from is incredible, right? To have the experience of being a journalist in D.C. and see kind of the inner workings of what's going on, that had to, I would imagine, help you in the boardroom, because that's insight that very few people get to see.
You're exactly right, and it's one of the reasons I was given the opportunities I was given in my corporate jobs, because it's invaluable experience to see how laws are made, how regulations are made, how politics and power really work. Politics, power, and money, I should say, because I was right there watching it and reporting about it, and covered so many congressional hearings and White House press conferences and even Supreme Court hearings. I've often felt, though, that maybe I was a bit too young to appreciate exactly the opportunities that I was given to be able to do that. I became a little bit cynical. I would be very cynical now if I were doing this kind of reporting right now. But it's eye-opening to see how things really do work,
Right.
and how big corporations and special interests really wield power at both the state and federal level. But I saw that up front, and I learned from that and used that in my corporate career, because one of the things I did at Cigna, my team and I wrote talking points for our lobbyists. My team handed out the campaign contributions that we made to candidates. So my job as a reporter, I saw how that is done and the importance of that to big companies, and so I was certainly well prepared. Sadly, I think I used my journalism career not to the best ends, at least initially, but it proved to be pretty invaluable to my employers.
And so did you make a transition from working as a reporter directly to Cigna, or was there a path along the way?
There was a path along the way. I actually was kind of enticed back to Tennessee from Washington to be a press secretary to a guy who was running for governor of Tennessee. He lost, and as a consequence, I was needing to have another job. I ultimately wound up working or getting an opportunity to be a partner in a small PR firm in Atlanta. And from there, I became I went on to be given a job at a big hospital-based system back in Tennessee, in Knoxville. And that was the beginning of my career in healthcare. It was first hospital-based. And at that time, the hospitals, many of them had HMOs. HMOs were relatively new at that time. Managed care was a fairly new concept, and I learned a lot. And then I was recruited from there to Humana, and had worked there for a number of years. I was there when Humana, which some of us may remember, was a hospital company that had a insurance division. But while I was there, the company decided to spin off the hospitals to focus exclusively on health insurance and managed care. So I helped manage the communications around that. But that's how I got into working for those big corporations. It was answering a recruiter's call and getting a chance to go from a hospital-based system to, as sometimes people have said, to the big leagues of working for a very major corporation.
Okay. Can you explain to our audience the dynamic between the lobbyists and the insurance carrier? How does it actually work? Because, we hear the word lobbyist, and I think there was a famous Shakespeare quote that says, what do you call, I don't know if it's a Shakespeare quote. What's the Shakespeare quote? It's, yeah. First kill all the lawyers. That might be in Romeo and Juliet. I'm not sure. But there's another quote, like, what do you call 1,000 attorneys chained to the bottom of the ocean? A good start, right? So the lobbyists, who often are trained attorneys, seem to be working against the public interest. I know many would beg to differ and say that it's a critical function and role, yada 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 yada. And I like you, I tend to be an optimist, and I like to think the best in people and things. And my outlook is generally optimistic. When I think about lobbyists, though, and whether or not they serve the American people, I get very cynical. Am I going down the right road in that cynicism, or is it misplaced?
You're going down the right road. And in fact, I would go so far as to say that a lot of the cynicism that Americans have is cynicism about our government and against politicians. And I would say, well, yeah, there's reason for that you should be upset and want to change things, but you should be most upset with how big corporations and their lobbyists and big special interests and their lobbyists have been able to really take over public policy and campaigns in ways that I don't think most Americans understand. So we get upset with the government. We're seeing it play out right now to a certain extent. But in my view, the greatest harm is being done by lobbyists who work for big special interests like the ones that I worked for. I was part of the Legal and Public Affairs Division at Cigna. That was the big staff division that provided all the legal support, all the lobbying support, government relations support, public relations support for the corporation. And my part of that was corporate communications. And I, for a good deal of my time there, reported to the general counsel, the top lawyer. So I worked with the lawyers day in and day out. And a lot of the lawyers that we had on staff were our lobbyists on staff in Washington, in some cases in the state capitals. We also had scores of lobbyists who were on retainer, who worked for big firms, mostly Washington-based firms or firms, again, in the state capitals. And they have inordinate power and influence. So you have good reason to feel the way that you do. Most people don't understand the extent of it. I've also said that most people don't understand the role that Wall Street plays in our healthcare system. That's something else I learned during my 20 years in the industry. But I also learned how these big corporations and their trade associations, like the Blue Cross Blue Shield Association and AHIP, which used to, is America's Health Insurance Plans, will their power and influence. They get so much money from these big corporations to also lobby. So it's an enormous lobbying operation that this industry has.
And so, in broad strokes, how is the game played? So I know that there was a tremendous amount of a huge spike in lobbying dollars just prior to the launch of the Affordable Care Act and Obamacare, right? So yes. Insurance carriers were up in arms about what this law would look like. They were all over it. And billions of dollars were spent with a B in lobbying efforts by insurance carriers and big pharma. What does that look like in terms of, and listen, this may be shocking to some people, but also there are very few people that I speak to that truly are insiders and have the inside dope on what's at work. You're one of those guys. So how does it work? Now you left Cigna prior to the launch of the Affordable Care Act, if I'm not mistaken, right? 2009, mm-hmm. Right? But I'm sure they were kicking around. The rumor mill was churning, or yes. the bill was being drafted, et cetera, mm-hmm. et cetera. What were the conversations like in the C-suite when that was on the radar?
In fact, that's another reason why I decided to leave, because I knew that if I stayed, I was going to have to play a lead role once again in trying to kill legislation that could potentially be really helpful to a lot of Americans. I had been in those rooms and contributed to efforts going back to the Clinton days when Bill and Hillary Clinton were trying to get healthcare reform passed. I worked many, many hours and made many trips to Washington working with my peers in the industry and our trade associations to figure out ways to sabotage that, to make sure it never was passed. It was certainly controversial, and I'm sure a lot of it would have been controversial if it had passed, and we would have a different kind of healthcare systems, but it never passed. We'll never know. And it never passed because we were so effective. We were concerned that, first and foremost, that it would hinder profits. We didn't care that much about how regular Americans might fare under healthcare reform as proposed by the Clintons. We were worried that it might cut our profits, or our profit margins might shrink. So that's why we were engaged in this. It wasn't because we felt it was bad for Americans. We felt it might be bad for our shareholders and our top executives. And that's the way it always is. It is not about the people. Now, to your point, more money was spent lobbying on that piece of legislation than any other bill in American history until that time. It was a massive amount of money, not just from insurance companies, but from pharmaceutical companies, from the hospital industry, from the American Medical Association, everybody who has a stake in U.S. healthcare had lobbyists and were spending money to affect the outcome of elections and certainly the direction of the debate on that bill and the writing of the bill itself. And these lobbyists have insinuated themselves so much into the fabric of Washington. They're people who've worked in industry or have good ties to industry that are in staff positions on congressional committees or in regulatory agencies. So they are there at the industry's. They've been placed there to protect the industry's position, and that's why the Affordable Care Act, in many ways, is written as it is. I would say even yet today that it did considerable good by making some things illegal that was just common practice by insurance companies before that time. But the industry was able to write big chunks of the legislation in ways that would enable them to prosper and to reap huge profits in the years to come, and they certainly have.
Yeah, one of the things that was baked into the Affordable Care Act was the MLR, the medical loss ratio.
Right.
And on the surface, it seems innocuous, right? It does make sense, like common sense, when the MLR states that 80 to 85 cents of every dollar spent must be spent on care claims. You say to yourself, well, that's logical. The majority of those dollars should be spent on care and claims. But when you pay attention to the other 15 to 20 cents on that dollar and you realize that the MLR says that the insurance carrier gets to retain that for administrative overhead and profit, then you have to peel back the layer and say, well, how do they make more money to benefit their shareholders, getting back to your Wall Street analogy, because the mandate of any for-profit entity, some would argue non-for-profit entity, is to generate revenue for their shareholders. And so they managed to, I could be wrong, and perhaps but I don't think the original draft of the Affordable Care Act or Obamacare included a provision for the MLR. My hypothesis is some very, very smart lobbyists and attorneys got together and they hatched a scheme and they said, we are going to bake this in. And what essentially the MLR does is it ensures that our rates are going to continuously go north. And why is that? Well, how do they make more money? The only way that they can make more money is if they bill more, right? They bill more, they get to keep 15 to 20 cents on that dollar back for administrative overhead and profit. How do they benefit their shareholders? By showing them a return on investment. How do they show them a return on investment? They charge more and they bill more and they get to retain more. Do I have that right, or am I way off base there?
You're not way off base. It happened in fact, when the first time I testified before Congress, that was on June the 24th of 2009. That was a day that I came to be called a whistleblower because I was testifying and pulling. I've often said I did it to pull the curtains back on how the industry really operates. And in that testimony, I did bring up the medical loss ratio, and I did because my name had been on every one of Cigna's earnings reports, quarterly earnings reports for 10 years. So I knew how much investors looked at the medical loss ratio. And investors and Wall Street financial analysts were pushing these company executives quarter after quarter to keep spending less and less on medical care so that the medical loss ratio would go down. And it was that unrelenting pressure from Wall Street that led me to even bring up the medical loss ratio in my testimony. But I think you're right. Executives saw this, if it was going to be inevitable that Congress is going to be addressing the medical loss ratio, let's see how we can benefit from that after this legislation is passed, and they certainly have. And I think an argument could be made that its existence in the bill or in the legislation has fueled, if maybe incentivized, but maybe fueled is just as applicable, the vertical integration of these big giant corporations. And Cigna's one of them that has changed from being a health insurance companies to one of these giant conglomerates now that's way deep into healthcare delivery in one way or another. But I don't think that lawmakers were paying attention enough.
This episode of Broken Healthcare Podcast is brought to you by Benefixa Healthcare Consultants. Visit Benefixa.com to learn what's possible. Reduce the cost of healthcare for your organization, deliver better outcomes for your people, and yes, design health plans that give your people a path to $0 out-of-pocket costs for healthcare. Visit Benefixa.com today.
Also, once the bill is passed, then you have how the regulations are written. And I saw that as well, too. That's done largely out of view because the media doesn't pay much attention to the regulations. I was a consumer representative to the National Association of Insurance Commissioners after the bill was passed, after it became law, because the NAIC was tasked by Congress to develop the regulations for that part of the bill, the medical loss ratio. And I have never seen anything quite like it. When I went to my first NAIC meeting, there were about a dozen of us who are consumer representatives at any given time. There were 1,000 representatives from industry.
Wow.
And they were there to certainly lobby the commissioners and to make sure, specifically, that they tried to make sure that the regulations around the MLR were written so that the industry would benefit. It was a sight to behold. That's just another way that power works. It's not just getting a bill passed and working to influence specific language in a bill, but also how the regulations are put together and put in place. They have made money hand over fist as a result of it. The other, I think, I know unintended from my perspective, and I think from a lot of lawmakers, was that it has also incentivized these companies to care even less about the rising cost of healthcare and the unit cost of healthcare goods and services. These companies, these big B.U.C.A companies, have never been able to do very much in terms of controlling the unit cost of any care, whether we're talking about drugs or a stay in the hospital or a doctor's bill. It's just not structured in a way that has been effective. But the MLR gave them no reason to care all that much, because as healthcare costs go up, they're able to just increase premiums. And as healthcare costs go up, there's more money that they're shoveling out the door to pay for healthcare. That means their MLR can go up and be within the constraints of the law, if I'm making any sense. But it's how it works. And because most employers think these big companies are the only game in town, they just accept these rate increases year after year. They've just been taking it for all this time, to the point that a family policy is now over $25,000. It's incredible.
That's right. And so it's counterintuitive, because when you think about any entity that's a for-profit business, and I think the way most people think about health insurance is they're not incented to pay out claims, because the more claims they pay out, the less revenue or profit, for the business. And that's in diametric opposite to what the MLR is. But they're not making money just on the MLR. There are multiple profit centers within these giant healthcare companies. And so, perhaps you can, opine on that. If you think about the MLR says bill more, make more, right? To really dumb it down. That's really what it says. And yet we recently, tragically lost the CEO of United Healthcare. Brian Thompson was gunned down in a street in Manhattan, and all over social media. And it's a crazy world that we live in where people are celebrating that. It's tragic. Here's a man that had a family, and left doing what he does. And you could argue that what he does wasn't very good. You could argue that he was trying to make a difference. Most people, I don't think know the details well enough to opine on that, myself included. But no one deserves to be shot down in anywhere in cold blood. No judge, no jury. But the thinking is it stemmed from a claim that wasn't paid. And so you have the MLR on one side, and you have this machine that is just making money every way you turn. They're making money on drugs. They're making, money on, they're the PBM middlemen. They own the PBM. So they're making money kind of with both hands, both feet, and they're an octopus. Every which way is more money coming in. You have the MLR that says even if they pay out beyond the scope of what the policy limits are, they're still making money. And so it's hard to wrap your head around that. But when you're an insider and you're talking about your P&L and how the organization is looking at the future to drive more profitability, what are those discussions like? And I would love for you to just comment on the passing of Brian Thompson.
I'll start with that. It was a horrific murder, and my heart broke for his family. He had children. He was a relatively young man, and I always try to make the point that it is not the individuals in that industry that are the problem. It is the system itself, and he could have been. In fact, some other executives have said he was a voice within the company to try to get the company to change so that United at least would be better perceived, more consumer friendly than it is. I didn't know him personally. I knew his voice from the many times that he spoke on the company's earnings calls with analysts, events that I used to help plan when I was at Cigna. And he was in New York, by the way, for United Health Group's Investor Day. And that's significant because I used to plan those events as well, too. It's a day in the year in which the executives go to New York. The invitations go out to a couple of dozen, not even that many, Wall Street financial analysts who work at big banks, and a few of the largest shareholders to come to this one day to hear from executives talk about how they are optimistic about the future, and here's why they are optimistic. So it's a big day, one of the most important days in a company's history, if it's a New York Stock Exchange company, as United is. United Healthcare, which Brian Thompson headed, is one of the big divisions of United Health Group, which is the holding company. And for much of the company's history, it was by far the largest. The other part of the company is called Optum. And over the years, that part of the company, that division, has grown much more rapidly. And it is that part of the company that operates the pharmacy benefit manager, the PBM, all of the physician practices that the company has bought, all the clinics, all the data analytic operations that they own. It's massive, just absolutely massive. And in fact, in 2024, Optum contributed more to profits than United Healthcare did. And this is a consequence of what I think I referenced earlier, vertical integration. When I was in the industry, most of the acquisitions that my companies made were buying smaller health plans to bulk up to be bigger health insurance companies. And that changed around the time that the Affordable Care Act was passed. It was beginning before then, but it just really took off after the ACA was passed. That these companies decided, well, we can make a lot of money if we own big chunks of the healthcare delivery system. And they've done exactly that. Cigna now owns Express Scripts. It still uses the name Cigna as its brand. And I think most people probably still think of Cigna as a health insurance company. But Express Scripts is by far bigger, brings in far more money, and generates far more profits than the health plan side. Far more.
It's crazy, right?
So
you can't even wrap your head around it. Like CVS bought Aetna.
Exactly.
But it's almost like, the basement bought the house.
It is exactly that. It's like the tail wagging the dog to a certain extent. But Cigna is a PBM that now has a health insurance company. That's exactly the way it should be viewed. And CVS, you mentioned, its PBM is called Caremark. It brings in more money to the parent than the company operates almost 10,000 stores. It did it its heyday. They've been closing a bunch of them, but it's one of the biggest retailers with about 10,000 stores, and it owns Aetna. But the PBM Caremark has brought in more money than either of those 10,000 stores or Aetna health plan. It's just crazy how these companies have changed and how they make money. And like I said, at United, Optum is now making more money for shareholders than United Healthcare, which is the insurance side. And those three companies, United, Cigna, and CVS, which owns Caremark, their PBMs control 80% of the PBM market, probably a little bit more now. They extract enormous amounts of money out of the pharmacy supply chain. In many cases, you can see that generics, the price that people pay for generics, in particular in this country, generics are relatively cheap, but they pay more if they use their insurance card at the pharmacy in many cases than they would if they paid cash, because they figured out how to make so much money on the pharmacy supply chain. In fact, in many cases, the PBM and its parent insurance company makes more money on a prescription than the drug manufacturer or the pharmacy by far. It's insane.
That seems perfectly reasonable. It's crazy. So, and I can, speak to my own personal experience. So I suffer with gout. I have high uric acid. And I am prescribed for B.U.C.A, or Uloric is the brand name. And if I go to fill that, I get my health insurance currently through my wife, who's a speech pathologist. She works in a preschool. We have United Healthcare. If I go to fill that prescription through United, it costs me just under $200 out of pocket for a 90-day supply. If I use GoodRx, which is free, and I get a coupon, I could find the same prescription at Stop and Shop or CVS or Walgreens, and using the coupon pay, depending upon the month, somewhere between $30 and $70 for the same prescription. And so I'm someone who's in the know. Most people are not, and sadly, that's a tremendous amount of money to a lot of folks who just don't have the money to spare. And this is what we're doing, to our people in this dysfunctional healthcare system that we have. And it's just crazy to me that is the case. Yet I am encouraged that we have an opportunity to pivot and change. And I don't know what your feelings are. And this is, I say it many, many times, like it's not a blue issue. It's not a red issue, whether you're Republican or Democrat. It's got nothing to do with it. Healthcare is at a tipping point, and our fellow Americans need something different, because what we have, the name of the show, folks, is Broken Healthcare, but it's working just fine for so many of the organizations out there. It's just not working so great for you and me. And so how do you feel? What are your thoughts? I I go out to LinkedIn and I see people, and primarily, if I'm anywhere on social media, that's where I am. And I'm reading all these, comments and all of these people who are up in arms about the new administration. And I think, I get it, right? There's just Trump's first term was very divisive. I think generally I'm seeing things are a little better now, but people are still scarred and burned and just, I get it. I understand. However, I am really, truly encouraged by what I see in that. I think what's inspiring is that we don't have nominees who are the same old, right? There's no way that you can inspire or expect change doing the same thing over and over again. This is the definition of insanity, right? So at the very least, I'm encouraged by the incoming administration, or now the new administration's direction. That said, is it going to make a difference? And here's why I say this. It's a $5 trillion buzzsaw that they're up against, and talk is cheap, right? So do the powers that be, the folks that think that healthcare is working just fine, do they exert their will and influence? And is it just more of the same old? Or do you think there really is truly an opportunity for change? What do you think?
I think there's opportunity for change. And I'm going to go back to a word you used a few minutes ago, sadly, when you were talking about being able to get your prescription, your medication with a lot less expense by using a card or using GoodRx. It's tragic that most Americans don't know that they can do that they're being taken to the cleaners, that they're paying money needlessly. And it's just another indication of how broken the system is, to use the term of your podcast. It's just outrageous. I remain optimistic, and I'm going to be spending a lot of time in Washington. I meet with members of Congress on both sides of the aisle, and now that Republicans are controlling not only the White House but both houses of Congress, that's really important, I think, from my view, to be able to talk to folks, to educate them. That's why I testified in the first place, is to help provide information that they don't get from other places all that much. They get a fire hose of information every day from all over. You can't expect them to have a lot of deep knowledge and understanding of our healthcare system.
Right.
So it's important for those of us who understand it to help them see it from a perspective that they just don't hear, and they hear every day from the industry's lobbyists. And you can be certain that my old industry and other parts of healthcare are doing their best and are succeeding in some cases in getting some lower level folks in positions of authority. That's happening. That always happens. I am encouraged that there's bipartisan support for reforming the PBM world. Significantly reforming how PBMs operate. There is bipartisan interest in looking at how these companies have profiteered on the Medicare program, on Medicare Advantage. They make money hand over fist in, I think, unethical ways.
Well, I'm glad you touched on that, because that, I believe, correct me if I'm wrong, is a particular area of expertise of yours. And
Yeah,
so for our seniors out there that are being bombarded with solicitations for these supplemental, Medicare programs, what do you say to them? Just if you could give us some basic guidelines for anyone that's listening that might be in that category, that's like not sure about what they should do. Because let's face it, everybody, you work your entire lives, you get to retirement age, and now maybe you're not in the workforce anymore, although I think more and more people are working longer than ever. So you don't have an income necessarily from a job, and you want to protect your nest egg. So fear, the four-letter word that starts with F, that I think drives all of this, all of the change and decisions that happen around healthcare. I think fear is something that is top of mind for folks in that category. How do we protect ourselves?
If you can afford it, I would encourage people to enroll in the traditional Medicare program and buy a Medicare supplement policy. It can be kind of confusing to figure out what's the best supplement policy because there's a lot to choose from. I have traditional Medicare and have a Medicare supplement policy that covers all my out-of-pockets. I've never had any out-of-pocket expenses since I reached retirement age, but I'm fortunate that I have the money to be able to afford a supplement policy, and it can be like $200 a month, and that's a lot of money for a lot of people who've retired, don't have, it's their fixed income. And that's why Medicare Advantage has been so appealing. And we are bombarded by advertising from various companies and entities that are trying to get us to see Medicare Advantage as kind of the silver bullet that enables us not only to be able to have health insurance, but to have some additional benefits that traditional Medicare doesn't cover, and they always hype these dental, vision, and hearing. But if you look really closely, you'll find that those supplemental benefits, the coverage is pretty skimpy. It's in many cases, it's hardly more than just discounts on them. And what's also obscured, and I think this is tragic in many cases, they never tell you that you may not be able to get the care that you need because of prior authorization, because of the ability of an insurance company to make a decision that the company will not pay for care that is medically necessary, that you need, that your doctor knows you need. That happens to people in private plans day in and day out. But it is also a hallmark of Medicare Advantage plans. People find out often when it's too late. They're in these plans, and these companies never mention that. They never tell you that you're going to be subjected in many cases to pre-approval before you will get coverage for care that you need. And that happened to my own mother. I had been a pitchman, a spokesman for Medicare Advantage plans through my jobs at Humana and Cigna. Medicare was big business. It was very profitable business for both companies. And I encouraged my parents to enroll. And when my mother broke her hip late in life, we realized that the network of doctors and facilities was very inadequate. There was no facility with any quality rankings anywhere close to where she lived.
Oh my God.
I was able to get her out of that plan. It's not easy to get out. People don't understand that that either. But they're problematic because of often inadequate networks of doctors and healthcare providers and clinics and skilled nursing facilities in particular. And you need that as you get older in many cases. And people don't know that they may not even get coverage for care that they need because an insurance company might need to make Wall Street's profit expectations next quarter. So they're going to tighten up on prior authorization, and that might mean that you're not going to get something that could save your life.
And you're an industry insider, and you fell prey to that.
I did.
Can you imagine? I mean, the general public doesn't have a chance.
Don't have a chance.
Is there a gold standard? If I am in the market, I become Medicare eligible, I enroll in Medicare, that's, through the U.S. government. Is there a gold standard for, or such a thing as a gold standard for a supplement?
There's some that, as I said earlier, it's a big choice. It can be bewildering. When I enrolled, there was, in fact, the choices are in categories like A, B, C, A, B, F, G, whatever. Just a whole bunch of letters of the alphabet.
Right.
And I think I enrolled in F, which at the time was the best. It was a bit more expensive, but it covers everything. I never have any out of pockets. I think G is available. And that might be the pricier one of the various letters.
Mm-hmm.
But if you can afford it, I would go with that because if you're in traditional Medicare, prior authorization is almost unknown. But in Medicare Advantage, it's very prevalent. In fact, the Kaiser Family Foundation, which does a lot of research into healthcare, made that point just earlier this year, of just showing how much it's used by insurance companies and how almost it's unknown in traditional Medicare. So you're much more likely to get the care that could save your life if you're in traditional Medicare and can get a supplement. And I would look at G, and at least that's what I would do to try to make sure that your out-of-pockets are covered. Now that is a flaw of traditional Medicare because it was enacted. Medicare became law in the mid '60s when health insurance in the private sector was largely indemnity based and paid, 80-20, 80%, and you were on the hook for 20%.
Right.
That was prevalent. But healthcare costs back then were far, far less than they are now, and I would argue probably more affordable for folks. So that was standard, and traditional Medicare hasn't changed much with the years. So you still have the possibility of having high out-of-pocket costs in traditional Medicare if you are hospitalized or have a chronic condition or something that needs expensive care. So that's why a supplement policy is important to have.
Yeah, for sure. And, folks who are listening, try to find a trusted advisor to help you navigate this stuff.
That's right.
Because it is rather complex, and it would certainly help to have the benefit of a guide who can help you navigate this maze. And
you're so right, Ray.
As with any insurance contract, and I mean any in capital letters and quotes, always read the fine print. This is not your iPhone contract. Read what is not covered in your insurance contracts. Always, the devil is in the details, and that will give you the lay of the land. Wendell, if I'm an employer listening to this, I'm a CFO, I'm an HR executive, and I am directly plugged into procuring healthcare for my people, and I'm in a fully insured plan, or I'm in a self-funded plan, and the carrier, Cigna or Aetna or United, is managing the administration of the plan in an ASO arrangement. And I feel like that is the safest place for me to be. Do you agree that it's the safest place? And if I define safest as protecting liability risk to my organization, A, and B, controlling the cost of healthcare, what do you say to that?
I would say that it's not necessarily the best bet to stick with Cigna or Aetna or United. It could be, but you owe it, I think, to yourself, to your shareholders if you're a public company, certainly to your workers to verify that, to shop around, to really shop around, and to your point earlier of engaging an expert, someone to help you figure things out. You can't expect a CEO or a CFO of a company to really understand the complex healthcare system. And there are some, I call them enlightened agents and brokers. I've met many of them over the past few years, as I've spoken to a lot of groups and been just to a lot of conferences. I was one in Milwaukee this last year by some folks who put together this conference called "Don't Feed the Beast," and the beast being the B.U.C.A, as you mentioned, these giant corporations that a lot of employers think are the only place to turn. There's no other alternative. But there are some smaller companies, maybe companies you've never heard of, but check to see how your agent or broker is compensated. Make sure that you have some understanding of that, how he or she is getting paid. You want to try to have someone who is really an honest broker who doesn't have any financial ties to an insurance company to persuade you to go one direction or another. So you need to check that out. And I would say that check out some options. I've written about some of them in my newsletter, Healthcare Uncovered. I have a section of the newsletter called Disintermediation. It's all about what is happening in the healthcare space by, I would say, enlightened agents and brokers, more ethical and transparent PBMs, the ability that employers need to know to contract directly in many cases with quality healthcare providers. There are a lot of options that you probably are not going to be hearing from the Cignas and Uniteds and the Aetnas of the world.
Yeah. Well, thank you for sharing that. And the conference that you're referring to is Matt Ort's conference out of Wisconsin. And Matt was a guest on our show, and he shared, a horrific accident that he was involved with where a tractor ran him over. And he was a VP of a steel company, a VP of HR, and, knew about the inner workings of the healthcare system and knew about the charges and the out-of-pocket expenses that he was going to be faced with. And the poor guy dragged his broken body for, I think what sounded like miles, and really went the extra mile, no pun intended, to try to avoid unnecessary charges and treatment at all costs, because to him, every dollar mattered. And our people shouldn't be thinking about that at a time of tragedy and a time of need. But the reality is people just can't afford it. And, we talked about it at the top of the show. There are 100 million Americans carrying some form of medical debt. 100 million. It's a third to a quarter of our population. Yeah. That's a staggering number. And it's far too great a number. And so your newsletter and the work that you do helps shine a light on what's going on out there. And I like what you said, because you didn't, talk in absolutes about whether or not an employer is doing the appropriate thing. But what I heard is trust but verify. Take a look at what's going on in your plan. Demand accountability from your partners, be it your broker, your insurance carrier, or both. Have access to your data. It's your data. You should have access to that data. And the more information that you have, knowledge is power. So you can then, with the proper tools and your executive leadership team, you can then make informed decisions. But one thing is for sure, if healthcare is a top payroll expense, typically second only to payroll, and the way that you're managing it is to just pay the increases every year, akin to blindly paying a credit card bill, it may not be the best way to manage the expense. I mean, after all, Warren Buffett said that GM is a healthcare company with an auto unit attached. And there's a man that knows his way around a spreadsheet and a P&L. There's a reason that he said that, and it's because the healthcare expense absolutely shocked him when he drilled into the numbers. And so I think there are many organizations that are in that boat, but you can't, there's no executive that's listening to this podcast that's thinking to themselves, I'm going to manage this expense by just paying the increases and thinking that's a good strategy. That's a terrible strategy. So you have to pay attention. And God bless you, Wendell, for coming forward and blowing the whistle and testifying before Congress. And also, I might add, when you are in D.C. In the future and you're speaking to representatives down there, I'm speaking for myself, but I think I'm speaking for many people when I say our elected officials should not be in the pockets of insurance carriers and PBMs. And if that's what they were used to, they should think about pivoting and figuring out a way to earn their dollars in some other form or fashion, because it's just egregious and there's no place for it in our society anymore. And I think a big catalyst, like you talked about the expense of Medicare back in the 60s not being what it is today, a big reason for that is the culture that has us going to a doctor and a doctor prescribing and moving on to the next patient, writing, prescribing, and moving on to the next patient. And I think the dispensing of drugs is just at all-time highs. It's only continuing to go north. It seems to be the solution for everything. And I think we're getting to a place where hopefully there's going to be a cultural shift to start thinking about preventative and maybe taking a page out of Eastern medicine and not being so quick to write and prescribe. I don't think it's going to happen overnight. I think it's going to be, this is going to be a process. But I'm encouraged for our kids and our grandkids because I think they're looking at a different future if we can get it right in D.C. and kind of right the ship, if you will, and get people working for all Americans as opposed to their bank account. If we can do that, I think we're going somewhere.
Right. I couldn't have said it better. And thank you for all you said just recently. I hope employers will also get more motivated to reach out to members of Congress to make sure that they are focusing on the right thing and are not in the pockets of the big special interest. And to your last point, I'm doing what I'm doing, continuing to do this, even though I left the industry and have been in Medicare for a long time now. It's for my kids and grandkids. I want to make sure that the system improves and is going to be there and covers what they need, and had to jump through so many hoops to get the care that they need in the future. Thank you, Ray.
Wendell Potter, thank you so much. Thank you for joining us, gracing us with your presence today, sharing, so much about yourself, your journey, and all that you do. We really greatly appreciate you. Mention one more time, how do folks find you?
You can find me on Substack. It's the healthcareuncovered.substack.com. Healthcare Uncovered is the name of my newsletter, and you can find me on social media most places at Wendell Potter.
Do you have any speaking gigs coming up, anything like that?
I'm going to be speaking to a group of orthopedic doctors in Arizona coming up in a few weeks. So I'll be out and about. I speak to a lot of employer groups and physician groups, and I'm encouraged in that regard too, because I'm seeing there's greater interest among healthcare providers to try to get things fixed because they're finding out that the insurance industry is not being too kind and generous to them, and they're incentivized to try to get engaged more than they have been in the past as well.
No doubt. I think doctors are more in the know now than they've ever been, and it's important that they are. They focus on medicine and on healing and the patient as they should, but it's also important for them to understand what's going on in the business end of things. And I think the work that you're doing is tremendous in that regard. So folks, get out there to Wendell's site, subscribe to his newsletter. It's free, so you can't beat free. There's not much better than that. And once again, Wendell, thank you so much. And until next time, folks, peace and love always. Take care.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.